the biggest one, we do a lot of Invisalign. And before I would just say, they would ask, always I talk to them about it in the first question, how much?
Sure.
And before I'd be like, yeah, let me get so-and-so to come in and talk to you about that. But now it's down to the point, I'll just say 5,000, just throw it out there and just read their facial expression and see what they say. And then off of that, then we have another conversation of, does this fit into your life right now? What can we do to help you for this to fit into your life? Or if it doesn't fit, then when do you see it happening? Is it 6 months, 12 months down the road?
Welcome to the Everyday Practices Podcast. I'm Reagan Robertson, and my co-host, Dr. Chad Johnson, and I are on a mission to share the stories of everyday dentists who generate extraordinary results using practical, proven methods you can take right into your own dental practice. If you're ready to elevate patient care and produce results that are anything but ordinary, buckle up and listen in.
Hey, everybody, this is Chad Johnson on Everyday Practices Podcast, the Everyday Practices Dental Podcast, now rebranded. And we're here today with Charles Major, who's near Nashville. Dr. Major, where do you practice? Is it Hendersonville or?
Murfreesboro.
Murfreesboro, yeah, that's right. So today Reagan is on assignment in a special fancy place, so I'll let her share that news later, but it's just going to be me and Charles today, so just so you know. So Charles, tell me, how many years have you been in practice?
I've been in practice for coming up on 8 years in May of this year.
Okay, and where did you do school?
I did at the Medical College of Georgia, which is now, I believe, Augusta University, because it's changed names about 8 times.
Yeah.
Like.
Okay. Did you go straight from undergrad to dental school?
No, I did not. I took a year off in between of dental school, or undergrad and dental school. The reason why I did that, it was to piss off my mom, number one. No, but it did piss her.
Hold on. I just didn't see that within the first 30 seconds. You're gonna be like, wait, what? All right, keep going.
No, so I actually took a year off because I played college football when I was an outside linebacker. So I went to the Citadel, the military college of South Carolina, Division I AA school, and I played football there for all 4 years that I was there. Initially, I did want to be an orthopedic surgeon. That was my initial career path that I chose, but then I went and shadowed a dentist who actually was a classmate of my mother's in college. And after I shadowed him the very first time, he threw me in there. He said, get some gloves on. If you want to do this, you need to do this. And so the very first patient he was working on, when I walked into his office, I put on gloves, didn't even have on the right size because they were all, it was all, wrinkled up. And I had no idea what I was doing. There was spit everywhere. The patient was choking. And, but after that, I picked it up, and I loved dentistry ever since then, especially to see the cool things that he was doing. And then also, he was an African-American dentist as well, too. And the fact that there was only 3 African-American dentists in Charleston, South Carolina, and to see his role or to see how he was a leader in the community and everybody around him looked up to him, that was another thing that I said, wow, I really could see myself being in that position as well, too. But coming back to your question, I did take a year. Yeah. I took a year off because in between dental school or in between undergrad and dental school, the Citadel was very rigorous on top of the academic, on top of the military stuff that we had to do. And then also being a student athlete, I felt like I was to the max, and I didn't really have real college experience because we were locked up. We only got to get off campus on Wednesdays, Fridays, Saturdays, and Sundays. That was it. So I felt like I wanted to enjoy my college years per se. And so to do that, I worked in the dental office, the same one with Dr. Freeman at the time. And I did my little fun college thing, you want to call it, in between. So that was the reason why I did take a year off. But then also I did want to have a little bit of a one-up in dental school as well, too, with the hand skills, the lab skills, everything that comes along with that. And he kind of said that. He said, if you do what I tell you to do, you're going to be very well set once you start school, essentially.
Yep.
And he was right, 100%.
Yeah. So you get done with dental school, and do you how did your practice start? Did you start your own de novo? Did you buy someone's? Did you associate first? How's that looking?
So when I graduated dental school, I moved to Atlanta. So I was in Augusta, Georgia at the time for dental school. And then after Augusta, I moved to Atlanta. After I moved to Atlanta, I did associate. The very first office that I associated in, I was there for right around 6 months time frame. And then after I left there, I went to another practice, and I was there for a little over a year. I think about around a year and a half. So that put me close to 2 years. And then right around the time I left the second practice was when I met my wife. She actually lived here in Tennessee, and met her. And I was actually looking for an excuse to get out of Atlanta. And she gave me after met her, fell in love, knew she was the one, said, look, I'm out of Atlanta. I'm done with this place. Yep. And moved to good old Murfreesboro, Tennessee, which is 10 times smaller than Atlanta, Georgia. But good place to grow family. Great. It's just a completely different mindset from here to Atlanta. I don't know if you've ever been to Atlanta before.
I've been to both.
Okay. You've been to Murfreesboro?
Yeah, passing through, because when we go from Iowa down to Nashville or Chattanooga or Atlanta or let's say Orlando, you're driving through there.
Right. Okay.
24.
Okay. Yep. That's exactly out there. And then after I moved here, I worked with the DSO, and I worked with the DSO for about 4 years. I was there with them for right up a little under 4 years when I opened my practice. And then I stayed on with them for about 8 months after I did open up my office. And I ended up doing a start.
Okay, so that's cool. So back up, associate. What was one take-home point for listeners that are in dental school or an early associate? I know it's putting you on the spot, but if you had, I'm not asking for 3 or 10, what's one, and it doesn't even have to be the best one, but what comes to mind as your, take-home point for being an associate?
The biggest take-home point that I do have for being an associate is if you do not feel comfortable in an office situation, you don't have to stay in that situation. You're in a professional career. You're in a setting where you dictate treatment, you dictate how you want to treat patients. And if you feel like somebody's pushing you to do things that you don't feel comfortable doing, do not stay in that position because it's not a good fit for you at the end of the day.
I like that. Okay, so fast forward to the DSO. That was kind of cool because that helped you transition while you were getting your practice started. But what was your take-home point from DSO land? Because you've done it all.
Yes, I did.
I mean, just think about it. You've done associateship. You've done associateship through DSO. You've done ownership. So, really, aside from retiring and selling, you've in 8 years gone through a good gamut that some people need to learn from. So, tell me, DSO, what was your take-home point?
My take-home from the DSO was learning as much as I could because I knew I was moving towards practice ownership while I was with them. So when I was with the DSO that I was with, they weren't very pushy on the treatment aspect of it. So that's why I stayed with them as long as I did.
Yeah.
They also had a very, very huge training component or CE component as well. So I learned how to do sedation. I learned how to do Invisalign. I learned implants. I learned a ton of stuff with them.
Wow.
And with all of those bigger procedures and helping me feel comfortable doing those procedures, that's what the biggest take home. I utilize every bit of the CE education that was offered by them to help me to further advance my career essentially there.
Yep. Cool. So eventually you start owning your own, and then you work your way out of the DSO contract. So looking into trying to maximize, your legacy and for your kids and stuff like that. How did you end up running into PDA workshop? So just for the listeners, that's how Charles and I met about 2 months ago. And so how did you come about finding the workshop? Was that Megan's find? Was that your find? A friend told you? What's up?
So when I was practicing at the DSO that I was at prior to opening up my office, it was a 45 or an hour and a half commute daily. So on that commute there, well, 45 minutes there, 45 minutes back. On that commute, I would listen to podcasts religiously, podcasts and audiobooks. And that's how I built up my knowledge about business, opening up an office, just listening to podcasts like you, listening to Bruce Beard, and just a whole plethora of podcasts. And a lot of, since I was so well versed in the different podcasts that I listened to, a lot of really successful dentists mention Bruce Beard. And they said, PDA, if you want to change your life, change the way you practice, you need to go to PDA.
Yep.
And when I was with the DSO, I was like, I'm not going to spend that kind of money when I'm not even the owner of this practice. So it doesn't make sense. And they have their own way of running things. So that's how they do it. And that's obviously I'm an associate here, so I don't have that full autonomy with that. So I've been hearing about Bruce Beard for a long time. And then after finally getting office up and running, seeing some of the inefficiencies we were having, and the biggest reason why we said, hey, we need to go to this seminar is because we're hitting our 12-month-ish time frame. And what we're realizing is at the 12-month mark, we were so fully loaded with hygiene recall, we didn't have any room for new patients at all on our schedule. And that was we could start to see a decline in what our production and collections were previous to the previous year there, even though the previous January was very slow because we didn't have as much going on, but I could see a decline from where we were at. We had an uphill traction going, and then it started to dip a little bit. And that was one of the main reasons, is the fact that we just didn't have the influx of new patients. And that's when we said, okay, there's something we need to do. There's something that we're missing. And then I said, this is a perfect opportunity for me to jump on what I've been hearing about for so long. And that's why we decided to make the trip.
Cool. So you went and you were looking at, the workshop with, trying to figure out, okay, what inefficiencies can we help solve, and how do we maximize our block scheduling and everything like that, scheduling to production, which to me was a brand new concept. I mean, because it's a little bit of a variation on block scheduling. I mean, did you kind of walk in? I seriously, I think my hands were folded and I was like, what? I mean, did that hit you the same way, that you were kind of like, what do you mean scheduling to production? And then if you're blocking out 6 hours for these veneers, like why would you do that when you only need an hour and a half? Or were you thinking along that line at first too? Did it kind of but you?
Yeah, I would say I wasn't, because I've already been listening to Bruce Beard.
That's what I wondered. Yeah. If his podcasts, which are super short, but they're to the point about scheduling, so you were pre-prepped for it.
Right. So I kind of knew what he was talking about because I heard him say it, but I didn't know exactly how to frame or how it would actually work in daily practice. But I will say my wife and I, we went in with a very open mind because we were willing to take in what we could and anything. And like you obviously know this because I did mention it at the seminar. I do a ton of CE, and mainly the CE is primarily clinical. But every clinical CE I go to, I always go in with an open mind because these people who are teaching these courses, they're experts. They know what they're talking about. They know what they're doing. They've tested it. They tried it. They know all the ins and outs of it. So who am I to come in and say, oh, I know all of this stuff. I know exactly what you're talking about.
Sure.
When I really don't. I don't have any clue about business. So I went in, I didn't really know, but I did know because I listened to it before, but I didn't know exactly how to go about it. That's a better way to put it.
Well, I was awfully heavy the last 10, 15 years on clinical CE, but I think what really helped was the PDA workshops and learning under Dr. Bruce Baird was that it taught me how the soft skills to be able to sell it. So that way, patients say yes to the treatment. So tell me, when you shared at the Saturday graduation, you were talking about risk factors and you wanted to implement that into your practice. So here's accountability time on the podcast in front of everyone. How's that discussion going with your patients? How's the risk factors discussion going?
It's going great, I will have to say, because now after hearing basically, and that's another component as well too, is the having conversations with patients, because going to all these CE courses or clinical CE, I know a lot of different procedures, but I didn't really learn how to talk to patients about them. And with the PDA and talking about risk factors and just having the or getting to know the patient as well too. Of course, during in dental school, never treat a stranger, all this, that, and the third, but you never really knew what not treating a stranger meant. Obviously, I'm
sure.
Yeah, correct. And I will say I am a personable person, so I will get to know a patient, but with what I learned at PDA, I was not getting to know patients on that kind of level.
No.
And so as soon as I came in, we changed our new patient intake sheets. I even redid it. So we have these sheets here. So every single patient, we go through everything. What's your occupation? When's the last time you saw a dentist? What things do you like to do? So the staff is already taking notes on the patient. So by the time I go into the room, I just have to look at the cheat sheet and just go ahead and open up the conversation again with them. And I think I can even see just from that's already been, it's helped out immensely with just planning and case presentation and things like that.
So what are some of your favorite one-liners that over the last couple months that you've started to use? Do you find that you're yourself saying, whether it's in the next 4 months, 4 years, we should, do you find yourself saying one of those Bruceisms or?
That, and then also, we're not going to be able to fix you overnight. This didn't happen overnight. We're not going to fix you overnight. That's a big one that I do use a lot as well too. And then there's another one.
Does that make sense?
Yes.
It's amazing how you're just connecting with people and they're like,
Yeah, and then also the ballparking as well too. I've started implementing that. The biggest one, we do a lot of Invisalign, and before I would just say, they would ask, always I talk to them about it in the first question, how much?
Sure.
And before I'd be like, yeah, let me get so-and-so to come in and talk to you about that. But now it's down to the point, I'll just say 5,000, just throw it out there and just read their facial expression and see what they say. And then off of that, then we have another conversation of, does this fit into your life right now? What can we do to help you for this to fit into your life? Or if it doesn't fit, then when do you see it happening? Is it 6 months, 12 months down the road?
So what I like about that is at first people are like, well, I don't want to be pushy. But the cool thing is if you actually broach it and then you dial it back and say, but you can do it or not do it. It's all the same to me,
Right.
And you leave it up to the patient to decide, but you gave them the opportunity to choose. It's so liberating because people, a lot more than I think we assume, will choose to do the healthy option. But a majority of dentists will say, well, I don't want to, talk to them about this or that. That's basically what it comes down to is like, well, I don't want to tell them they have, $30,000 of damage. They'll get up and leave. It's just like, well, what if you actually just said that? What if you said, this looks like it could be a, $30,000 bill. And I even just will say, frankly, that's a lot of money. How do you feel about that? And it's amazing because sometimes people say, I was even thinking, I read online, it was 30 or 35. And it's just like, so they knew. And so I wasn't the first one to broach it. And now I get to say, well, what do you think? Do you want to make a move to get that healthier, or is now a good time? Just like you said. And they might say, I've got 3 kids in braces right now. And I'll just say, hey, totally get it. How about I make a note in the chart and we'll bring it up in a couple of years, because I know it's important to you, but I also don't want to overly bother you with it. And one of the lines, I'm trying to think what his name was. He'll, when he's lectured at a PDA Blue Sky event before, it's we'll wait with you, and using that line, just it's okay, we'll wait with you, and the pressure's off now. It's like we've discussed it. It might be a yes, it might be a no, it might be a maybe, but just broaching the subject and at least feeling them out where they want to go with it, as opposed to not even bringing it up.
Right, and it's funny that you said that, because I even had one patient that I did throw out the number. I was like, it's right around 15,000. And he was like, the first response was like, that's kind of what I was thinking, what it was going to be, something around there. So he was already prepared and he knew. And as soon as I said that, he was like, okay, that's what I was thinking.
Well, practicing that with patients, because, if I do 2 $25,000 arches and, so I'll say, listen, I get it. This is expensive, but dentistry is full of expensive and more expensive, but there's no cheap dentistry. So when I'm looking at this case, you want to do upper and lower, it's going to be $50,000. And just to at least, like you said, kind of read them. And the guy said, I figured it was 25,000 upper and 25,000 lower. So when can we get scheduled? And it's like, but it's cool because if you're resolute about saying that, as opposed to feeling bad about telling someone that it's, 1,000 or 1,500 for a crown or something like that, that you can go in and say 50,000. I mean, that's a huge number to throw out, but just to say it straight face and be compassionate too, to say, I know that's a lot of money, but I mean, I'm trying to help. You and I are on the same team. We're trying to solve this problem. And so I'm kind of your Yoda that's trying to help you get to where you want to be. And this is going to be what it's going to cost. I mean, do you want to move forward or do you want to think about it? What do you want to do?
I want to real quick to another Bruceism as well too, is the judgment free. Just letting patients know, because they come in and they're already, like he said, they come in tensed up, they're looking around at everything. And then as soon as you tell them, they're like, I know I've just been dreading this appointment for a long time because I know I got a lot going on and this, that, and the third. And then I just sit there and talk to them. I'm like, look, I'm not going to judge anything that you did in the past. What we're going to do is we're going to focus on the future. You're here right now and you're here for a reason. The reason why you're here is because you want to get better. If you want to get better, I will help you get better. But at the ultimate thing, we're going to have to do this together. And as soon as we have that conversation and I let them know that I'm not judging them, just like Bruce said, you can just see everything, just their shoulders get less tense. They just sit back in the chair a little bit more. And it just opens up everything. And then they start sharing a little bit more with you about why they don't like dentists and this, that, and the third. And then we can just kind of have a conversation of what they should be expecting with everything moving forward. So yes, that was another huge one that I took from that as well.
Well, so what's your 10-year plan? What do you want to see in your practice?
That's a very loaded question. My 10-year plan, I want to be at a point where I'm not doing fillings anymore. I don't want to be wasting my time doing fillings. I feel like I want to be doing very comprehensive cases. I've been doing a ton of training, and I feel like that's where my passion is doing, pretty much like Bruce said, seeing train wrecks and fixing the train wrecks. So that is my ultimate goal and passion. In order for me to do that, obviously I'm going to need to have an associate in place for that. And I also want to be at a point where I'm practicing more just because I want to have fun practicing, not because I need to make money in order to pay bills. At the end of the day, I don't want to feel financially bound to doing certain things.
Do you think you'll get there in 10 years?
Oh yeah, that's my goal.
Good. I respect guys like you, military personnel, college athletes that have a different degree of tenacity to achieve a goal. I love seeing that grit. And I don't know, it's kind of a softball question to lob at you. Like, do you think you'll get there? Because I suppose the realistic answer could be like, no, it's probably going to take me 12 or 15. But I could tell before I even asked, I was like, I think I knew the answer. I just wanted the audience to hear it. So I'm proud of you. That's awesome. Hey, fill me in. Megan helps with your social media. So how's she attracting her ideal patients, especially now that she's gone to the workshop and gone through that marketing afternoon that we talked about that stuff?
Well, she is, it's funny you asked that because now it's just, her focus right now has been a schedule. She did take a lot from the social media aspect, but, and we've been kind of talking about different ideas and patient meals and things like that we've been discussing. And that was another huge one, was having raw testimony footage. So we don't bring out our phones or cameras out enough, I feel like, in the office, because we've had several patients breaking down, and I was like, I wish I would have gotten that on film.
Yes.
And now it's one of those things we're trying to be focused on being ready for, and that's whenever if I have a patient, I'll say, hey, get your phone ready so we can go ahead and record this.
Yeah, I like that. So let's say someone, I've got two questions. Let's say someone is hoping to do a scratch start. What's your advice?
My advice is location. Make sure you find the right location. That's huge. That's what's been key to our early on success. Reason why I say early on, because I don't feel like we're successful yet. But that will put everything in the right place in order for you to be successful. Because if you don't have the right location, because I've listened to quite a few podcasts, and that's one of the biggest things that I've heard is they didn't have the right location, so they struggled initially. And that, I feel like that'll take a lot of weight off your shoulders about worrying about getting patients to come through the door. And sorry, what was the other question?
No, I didn't give you the second one yet, but the second one is kind of like it. So the first one, was what advice would you give for scratch start? And you said location. So now let's say that someone has done a scratch start, they've picked the perfect location, but they've still got some struggles. What would you tell doctors wanting to consider, or, like checking into the PDA workshop?
Oh yeah. So I would definitely tell them, obviously, check out the PDA workshop. No ifs, ands, or buts about it. I feel like there's different sets of courses that you should take at different points of your careers when it comes to doing a startup, or when it comes to certain areas of expertise that you're looking into doing. And PDA, I feel like if you're going to open up an office, whether if it's a acquisition or a scratch start, you need to go to PDA because they will retrain your brain from what you thought before and make it make sense in order for you to be successful in your business. And then also, obviously, like individuals like you who are faculty there and seeing your success and just hearing your stories. And then even there were several other dentists there who were who it wasn't their first time there. There were quite a few dentists who were there that wasn't their first time, and just hearing their stories and how they went in and applied everything, and they listened. And when they listened, they applied it. It made sense, and it actually helped them boost, get to the levels that they wanted to be there, essentially.
Right. Well, cool. Good. Thanks. What's on the horizon for you? Like, what's this next year look like as far as implementing? Let's do clinical CE first. What are you looking at?
Clinical CE, I am looking at, I just took an occlusion course this weekend, and that just blew my mind with a lot of treatment planning, because, like I said, I actually am I'm a spear guy, so I'm doing the whole spear track right now.
Sure.
But then obviously, to a lot of you guys at the PDA, I'm looking into COIS as well too. And then with the occlusion course that I took this weekend, I'm kind of considering either Pankey or Dawson as well too.
Sure.
So, but yes, no, this year is going to be a lot of surgery. I'm doing a big implant surgery continuum in Alabama. So that's going to be my focus for this year.
Nice.
And systems, business systems, obviously. And we also did do coaching as well too. So we do have the PDA coaches. We're starting that process as well. So
cool. When do you get started with that?
We actually had a meeting with Callie and Christine today. So
nice.
We had our onboarding 2 weeks ago, and then today we actually did the full out breakdown of what we're looking at, the goals that we're trying to set. And it's funny that you said, do I see myself being there in 10 years? And that was a conversation we had with Christine today, because Christine said, I want you to shoot for this goal, because this is what goal is going to, collection goal is going to help it make sense for you in order for you to pay your bills, and then also for you to make the money that you need to be making.
That's right.
And when she said that, she was like, so how do you guys want to slowly step up? And I said, no, we're not stepping up. We're going to start that from day one. That's what we're shooting for.
That's the beauty. Every office, like, there are some people that are more successful with going at their own pace and slow as, I mean, I've just seen it work actually, that I have some PDA friends that have done slow and steady, and it works for them really well, as opposed to necessarily, like just going out the start gate too fast. But then there's other people that are like, no, I'm all in. And the cool thing is, there's not a right or wrong. It's what do you as the leader want to do? And then they'll help you achieve it. So that's awesome, because like basically you're kind of giving them the green light to be like, all right, let's do it.
And that's what they said. We're going to hold you accountable every step of the way. So
I bet.
Please do.
I mean, because here I am. I'm 7 years into coaching, and I'm still, trying to calibrate and rewire and get myself to be better and better. And 10 years from now, I'll be better, but I still will have improvement to make. I never would have thought that I'd be still at a point where, but coachability is a mindset, right? You talked about that earlier indirectly, that you have to be willing to be like, I haven't arrived. I've arrived to a spot, and that's good. I'm better than I used to be, but I've got more growth and development to do. So yeah, good for you. Well, hey, listen, I appreciate you coming on for the last, I don't know, half hour-ish and, talking this stuff through. This was really good content. I really appreciate that. And hopefully the listeners will not only get a kick out of some of this, some good nuggets, but maybe even a year from now, we revisit with you and Callie, let's say, and say, all right, so it's been a year, how's stuff going? What are you implementing and stuff like that? But I'm really proud of you and Megan, and it was good sitting at lunch with you on that first day, and kind of checking in, and that's kind of why I wanted to get you on the podcast, was to kind of give your story.
So yeah,
well, thank you so much for joining us today. Much appreciated, man.
No, thank you for having me. I appreciate it.
Reagan Robertson here with Productive Dentist Academy. Get ready to join your favorite podcast hosts, Dr. Bruce B. Baird, Victoria Peterson, Dr. Chad Johnson, and myself, Reagan Robertson, at the nation's #1 dental business course that guarantees practice growth. That's right, full immersion CE, so you can consistently produce more and align your team for results without compromising excellent patient care. Productive Dentist Academy has a special running this month that you can activate immediately. It's called the PDA Productivity Bundle. And we put this together so that you could attend this workshop, which is happening September 22nd to the 24th in Frisco, Texas at the Hyatt Regency, along with tools to make sure that not only are you getting great education on how to increase your productivity, how to communicate better with your team and your patients, increase your case acceptance, authentic market practice, and more, you also get a 2-hour business advisory session before the workshop to really get clear on what matters to you most so that you can be set up for success at the workshop. And following the workshop, you get 12 months access to PDA On Demand. That is the entire productivity workshop on demand for you to make sure that you are doing everything you can in your power to soak up all of that CE and implement it come Monday morning, the next month, and the next month, and the next month for 12 months down the line. Registration is now open. The tuition cost is $2,195, which is ridiculous because it's regularly $5,528 for the productivity workshop attendance, 2-hour business advisory session, and 12 months access to PDA On Demand. Hop on over right now to www.productivedentist.com/workshop to grab your registration today. Again, that is www.productivedentist.com/workshop. If you cannot wait and you have to have it right now, email Brent, B-R-E-N-T, at productivedentist.com. That's Brent, B-R-E-N-T, at productivedentist.com, and we will save you a seat. I look forward to seeing you there. Thank you for listening to another episode of Everyday Practices Podcast. Chad and I are here every week thanks to our community of listeners just like you, and we'd love your help. It would mean the world if you can help spread the word by sharing this episode with a fellow dentist and leave us a review on iTunes or Spotify. Do you have an extraordinary story you'd like to share or feedback on how we can make this podcast even more awesome? Drop us an email at podcast@productivedentist.com. And don't forget to check out our other podcasts from Productive Dentist Academy at productivedentist.com/podcasts. See you next week.